Sir, I would honestly like to say that you are one of the most inspiring people that I have met till now. There was one period when we actually did not have any issues studying anatomy, and that was when you taught us. So we had a lecture, I think, in January 2020 when you were there as a faculty, and we had an amazing time, sir. We had 150 odd students, and none of us felt that anatomy was a very difficult subject or something that would make our heads feel like dizzy or something. So, sir, we were genuinely very happy, and your past 25 years of experience certainly reflects. But more than that, I think the most important trait that I have seen personally is the kind-heartedness that you have and the humbleness that I have seen. So you're genuinely very inspiring, and please continue to shower us with all of your love.
Thank you for your kind words, Ipshita. So good evening to all of you. I'm Dr. Pradeep Pawar, Professor of Anatomy, and I've been teaching for the postgraduate entrance students, for the foreign medical graduates, for the NEET, and now we'll be teaching for the next. Since last many years, I've been teaching the first year medical, dental, physiotherapy students also. So let us have an interactive session today. I'll just brief the important topics that you have to know, that you should know as far as exams, as far as vivas are concerned. And I'll be asking you some questions in between. Let us go system wise. The important topics we'll see in each system. Okay. I'll share my screen. Okay, just one moment. Right, so let us start with the upper limb. Students, as we all know, you can answer in between when I'm asking you questions. As you know, the brachial plexus, that's a very important question. Most of you must have been studying the brachial plexus. You must be knowing how the brachial plexus is there in the body. But what I want you to understand, and let this concept be clear, so from your PG point of view also it will be easy, answering the vivas also it will be easy. Now when we classify the brachial plexus, some important things I'll tell you about every topic which I feel you should know. So when we classify the brachial plexus, we know what are the parts of brachial plexus, right? Roots, trunks, division, cords and nerves. Out of this, a part of the brachial plexus is above the clavicle. What we call this as the supraclavicular part of the brachial plexus, and a part of it is infraclavicular. Would anyone tell me which is the supraclavicular part? I mean, what is the supraclavicular part of the brachial plexus made up of? Yes. The question is open to all of you.
Roots and the trunks?
Yes, very good, very good. Roots, trunks and divisions also. Okay, the divisions are just behind the clavicle, but yes, the roots, trunks and divisions, they are supraclavicular. Right, where do they lie? They lie in a triangle of the neck. Now this you have to know. In which triangle of the neck are you going to get the brachial plexus? Anyone?
Posterior triangle?
Posterior, to be still specific. If I am a very specific person.
Occipital triangle.
No, it's not occipital. It's supraclavicular. Very good, very good. Supraclavicular or the subclavian triangle. That's the supraclavicular part of the brachial plexus. Roots, trunks and divisions. And further going into this topics, this roots, trunks and divisions lie in the posterior triangle, in the supraclavicular triangle. Between two muscles they lie. Between two muscles. Would anyone tell me which are those two muscles? Now this is something very specific.
Scalenus anterior and scalenus medius.
Very good, very good. Yes, between the scalenus anterior and scalenus medius. Perfect. Now which is the infraclavicular part made up of the cords and the nerves? Cords and nerves. So cords and nerves, they are around an artery, around the axillary artery, and the cords and the nerves and the axillary artery, they are put in a sheath. What is that sheath known as?
Axillary sheath.
Axillary sheath is a continuation of a fascia of the neck. Now these are
Prevertebral fascia.
Prevertebral fascia. Very good. So these are some very important things that you have to know, which will be definitely asked in the exams. So now, axillary artery is divided into three parts by a muscle. Which muscle is that?
Pectoralis minor.
Pectoralis minor.
Pectoralis minor divides the axillary artery into three parts. Now, something very important I'm telling you. So, in the first and the second part of axillary artery, which part of the brachial plexus are you going to get? In the first and the second part. And which part are you going to get in the third part of the axillary artery? So, एक minute. So, infraclavicular part is made up of cords and nerves, right? Cords and nerves. So, in which part of the axillary artery do you get the cords and which part do you get the nerves? Okay. Yes?
Cords in the upper part and...
No, it's not upper part. First part, second part and third part of axillary artery, which is divided by the pectoralis minor. So, where do you get the cords and where do you get the nerves? Understand? In the first and the second part, yes. So in the first and the in the first and the second part you get the cords, and in the third part you get the nerves. So first and second part में cords, third part में nerves होता है. One very important MCQ: the cords are placed according to the names in which part of the axillary artery?
Second part.
Second part. Cords are placed according to the names, meaning the lateral cord is lateral to the artery, the medial cord is medial, and posterior cord is behind the artery in the second part. First part may be cords होते हैं, but in the first part the cords are not placed according to the names. They are just randomly placed. They are very randomly placed. So suppose you become a neuro surgeon, right? MCH, brachial plexus in future. Oh, you want to do neurosurgery and you plan you get MCH neurosurgery. Okay, fine. You are MCH brachial plexus now, and you are operating on the lateral cord of the brachial plexus. So now after reflecting the skin superficial fascia, the pectoralis major muscle, now you see a muscle right in front of your eyes. What is that going to be? After reflecting the pectoralis major, that's the pectoralis minor. You reflect the pectoralis minor, which is that part of the axillary artery that you're looking at. I hope you can visualize with me. The second part of axillary artery. The second part of axillary artery, and the cord which is lateral in the second part has to be lateral cord. Right? The cord which is medial in the second part has to be medial cord, and the cord behind has to be posterior cord. So this is something that you have to know. And in the third part, what are we going to get? The nerves. In the third part, we are going to get the nerves. So see, for example, I get a question on musculocutaneous nerve, for example. So what is the first thing that I write? Musculocutaneous nerve is a branch of anyone.
Lateral cord.
Lateral cord. So musculocutaneous nerve is a branch of lateral cord. So where do I get this musculocutaneous nerve? Which part of axillary artery? Which part of axillary artery? It is the third part of axillary artery. All the nerves are present in the third part. Okay, so we'll get that in the third part of axillary artery. On which aspect? Because it's a branch of lateral cord, it would be lateral. Are you following this? So musculocutaneous nerve would be present on the lateral aspect of the third part of axillary artery. So my nerve begins from here. Like ulnar nerve, if I have to write something about ulnar nerve. First point, it's a branch of. So any nerve which comes as an LAQ for you. So first thing, it's a branch of. Tell me, ulnar nerve.
Posterior cord.
No.
Medial cord.
It's a branch of medial cord. उसमें गलती नहीं करने का. It's a branch of medial cord. So if I have to search the ulnar nerve, where do I search the ulnar nerve? It's a branch of medial cord. तो ये medial aspect पे होगा. It's a nerve, so it will be where? In which part of axillary artery is it going to be?
Medial part of the third. Medial side of the third part of axillary.
So third part of axillary artery on the medial aspect. Okay, that's how you begin any MCQ. Like if you get an MCQ on the ulnar nerve, it's a branch of medial cord. It is present on the medial aspect of the third part of axillary artery. Okay, so this is how you begin the answer. And the radial and axillary nerves, where are they going to be? They are going to be on the posterior aspect of the third part of axillary artery. Are you understanding this? So this is something very important that you have to know. So then the course of the nerves and all, if you can quickly tell me the course of the medial nerve. How's the medial nerve formed? Just take a review देता हूँ एक nerve का बस. How's the medial nerve formed? By two roots. One is the lateral root of medial nerve, and the other one is going to be the medial root of median nerve. Just one moment. Quickly tell me this. Okay, so if I draw this as the axillary artery, and if I draw this as the pectoralis minor muscle, students, pectoralis minor. So now you quickly tell me, what is this going to be? I just have to keep on changing the colors. What is this cord going to be? What is this cord? And what is this cord going to be? Second part of axillary artery, hai? So this is the lateral cord, medial cord and posterior cord. So these are going to be the branches of lateral cord. I'm just interested in this. These are the branches of medial cord. Tell me who's this, and therefore who's this? Tell me who's this? You can see the pointer.
Median nerve.
No, this is not median nerve. Median nerve is this. This is the median nerve. So what is this? Yes, students.
Lateral root of median nerve.
That's the lateral root of median nerve. What is this going to be? That's the medial root of median nerve, and that's the median nerve. So when the median nerve is formed, see this are all very fine, very minute details, right? Normally when we're reading this, we never think about this. So if I put an MCQ, what is the relation of the median nerve with respect to the axillary artery? What do you write? Where is the median nerve formed with respect to the axillary artery? Anyone?
Anterior.
Anterior, nahi, not anterior. Where is it? What is this aspect?
Lateral.
Lateral. So when the median nerve is formed, it's lateral to the third part of the axillary artery. Getting this? Because there's someone who's going to cross the axillary artery from the medial to the lateral side. Now what is this? This was an MCQ. Long back in AIMS, there was an MCQ. No, not medial nerve. The structure which crosses the third part of axillary artery from medial to lateral side. Look at the slide and tell me.
Medial root of median nerve.
It is the yes, medial root of median nerve, and this is the lateral root of median nerve. That's the median nerve. So who's going to cross the axillary artery? The medial root of median nerve. It goes to the lateral side, joins with the lateral root. The median nerve thus formed is lateral to the third part of the axillary artery. The median nerve is now going to cross this artery. What is the axillary artery later becoming? What is the axillary artery later form? The brachial artery. So the median nerve will cross the brachial artery from which side to which side? Now this is something that you never think of. The median nerve crosses the brachial artery from which aspect to which aspect? Look at this. It comes from the lateral to the medial side, right? It comes from the lateral to the medial side, and that is how. See, this is so nice. Now you tell me who's this? What is this that I've drawn for you? Cubital fossa, and that's how now when you see the cubital fossa, the most medial structure in the cubital fossa has to be median nerve, right? So that's how the median nerve comes as the most medial content of the cubital fossa, followed by is this now the brachial artery with its two terminal branches. Then you have the tendon of biceps, and the last content is going to be what? The most lateral
branch of the radial nerve.
The radial nerve, which then divides into two branches. Yes. So you're clear? How does this median nerve come here? Just a quick brief I'm telling you about the median nerve. Tell me quickly, how does the median nerve leave the cubital fossa? How does the median nerve get out of the cubital fossa to enter the forearm? Anyone? Yes?
Piercing 200 cm.
Very good.
It pierces the septum.
No, it passes between the two heads of pronator teres, and this median nerve can get compressed between the two heads of pronator teres, and this is what we call as the pronator teres syndrome. Pronator teres syndrome. One very favorite questions in the Viva. Now the median nerve is in the forearm, correct? In the forearm, it has gone through the cubital fossa. It's now in the forearm. Tell me, in the forearm, this median nerve lies on which muscle?
Flexor digitorum profundus.
Very good. Flexor digitorum profundus. And below which muscle? Below which muscle does it lie? It lies on the profundus.
Flexor digitorum superficialis.
Yes, it lies below the flexor digitorum superficialis, and it lies on the flexor digitorum profundus. Is there a similar nerve like this who's also lying on the profundus but below the flexor carpi ulnaris, right next to the median nerve? Yes.
Ulnar nerve.
Very nice, very nice. That's the ulnar nerve. That means on the flexor digitorum profundus there are two nerves. One is the ulnar nerve, one is the median nerve. And who's covering the ulnar nerve? Flexor carpi ulnaris. That means I just want you to remember, if you lift the flexor carpi ulnaris, what are we going to see? Ulnar nerve lying on the flexor digitorum profundus. And if you just lift the superficialis, that is going to be the median nerve. Like these are certain things which you have to know. And you just lift the muscle, the nerve has to be there. Fine. The median nerve now comes to the wrist. And how does the median nerve enter the hand? It goes through the carpal tunnel. ये आपको पता होगा. And compression of this median nerve in the carpal tunnel is known as what? The carpal tunnel syndrome. Okay, carpal tunnel syndrome. And then the muscle supplied by median nerve of the hand. So now that your exams are closed, you must be revising everything, and I mean you must be knowing everything. So this is just a added points for you, just the toppings. What are important things that you have to know? Okay, so that's about the median nerve. The muscles supplied by medial nerve that you have to know. You just name them. Just name the number of the muscles. How many muscles are supplied by medial nerve? In the hand. In the hand. In the hand. Just a number. 1, 2, 3, 4, 5. 5 muscles. 5 muscles. Now, what is a composite muscle? That is something very important. Composite muscle and MCQs are there. Composite muscles are asked in the as a short note also.
FDS.
Composite. A composite muscle is a muscle which is supplied by 2 different nerves. Can anyone tell me the list of the composite muscles in the body in the upper limb? One is the pectoralis major, which is supplied by 2 nerves. Just name the nerves. Pectoralis major, lateral and medial pectoral nerves. Very good. The next muscle is in the arm. That's the brachialis. Brachialis is also supplied by 2 nerves. Name.
Musculocutaneous radial.
Very good. Ipshita. Students are really good, huh? Ipshita. Ipshita is listening. Yes, it's brachialis, medialis, musculocutaneous, lateralis, radial nerve. Flexor digitorum profundus, again a composite muscle. The medial half is supplied by whom? Flexor digitorum profundus. The medial half?
Ulnar nerve.
No. Flexor digitorum profundus. Yes, the medial half is ulnar nerve. The lateral half? Lateral half.
Medial nerve.
Lateral half is a branch of medial nerve. It's a branch of medial nerve.
Anterior
Anterior nerve. Excellent. And there's one muscle of the thenar eminence which has got a dual nerve supply. Can anyone answer this? A muscle of the thenar eminence having a dual. Flexor pollicis brevis. Correct. The superficial head is supplied by medial nerve and the deep head is supplied by ulnar nerve.
Ulnar nerve.
Excellent. Excellent to all of you. Okay. So this is something I just wanted to get an orientation. Koi bhi nerve aayega, you have to mention this points. This is how you're going to write about it. Okay. So something about the spaces in the arm. Can anyone quickly tell me? Spaces in the arm is another very very important topic. Spaces around the arm. Ek minute, I'll just and see always make this line diagrams so that it will be easy for you. It will be easy for revision. Jitna line diagrams draw karoge, it is going to be easy. What is this aspect that you're looking at? Which is this aspect? Dorsal ventral. Tell me. Dorsal. So you get something here for the scapula, something here for the scapula. What is that? What is this known as for the scapula?
Glenoid cavity.
No, this is the glenoid cavity. There's a small tubercle there. The supraglenoid tubercle. Very good. And this gives origin to
long head of biceps brachii.
Long head of biceps brachii. Correct. And the infraglenoid tubercle gives origin to the long head of triceps. Okay, so I just draw the long head of triceps here, which will be getting inserted down on the olecranon process. Perfect. Now you tell me, this is the dorsal aspect of the scapula, lateral border, 2 muscles attached here. What is this muscle?
Teres minor.
Teres minor, and this is going to be teres major. Okay, similarly, what is this muscle? Ye bhi khatam karte. What is this muscle on the medial border, dorsal aspect from the superior angle to the spine?
Levator scapula.
Levator scapula. What is this muscle opposite to the spine? Rhomboides minor. And this is the rhomboides major. A small muscle here.
Latissimus dorsi.
Beautiful. Above the spine is going to be the supraspinatus, and below the spine is going to be the infraspinatus. Infraspinatus. Correct. Okay, Ipshita.
Yes, sir.
Start. We'll start. Share screen. Hello. Ipshita.
Yes, sir. You're audible and visible. So please
Yeah.
start sharing on your screen.
Yeah. How do you share? You share it. वो PowerPoint का presentation किधर गया?
Sir, मैं share करूँ क्या?
करो. That's fine.
I'm giving you the control, just take a minute. See if you can control my screen.
No, you start. No problem. You start. I'm not seeing you. I'm not seeing. Do that. नहीं हो रहा ना, नहीं हो रहा.
एक minute, sir. So now does it show you something?
Yeah, I'm seeing.
Now can you see it?
No, it's the desktop is seen. मैं नहीं दिख रहा हूँ उसमें. इसको बड़ा करो ना, ये स्क्रीन को.
मैं कैसे करूँ?
तो कैसे करने का?
सर आपको एक बार स्क्रीन शेयर करना पड़ेगा अपना. एक बार शेयर कीजिए, मैं करती हूँ.
But how do I share the screen? Okay, चलो okay. Where is that PowerPoint presentation?
Sir, I'm not sharing anymore.
Just wait. Okay, done. Fine. Is it fine? Audible now?
Yes, sir.
Sorry for the delay. Sorry for the interruption. Sorry. Okay. So students, are you able to hear me?
Yes, sir.
Okay, I'm so sorry for that.
Yes, sir.
Okay, so we were drawing that spaces around the arm. So now that must have gone. Spaces around the arm is what we were discussing. Right. We go through it. So, bull fast. I'll just start that once again for you. So this is how you draw the line diagrams, just for your understanding and practice. The more slides you see, the more your concepts are going to be clear. This is what I always tell the students, because see, you have a long head of triceps, right? That's a long head of triceps. What was this muscle here? This muscle which begins from here, that was teres minor, that's teres major. Where's the insertion of teres minor? It is inserted on the greater tubercle third impression. And where's the insertion of teres major? Can anyone answer this? Teres major?
Medial lip
of the bicipital groove. So that's a teres minor, that's a teres major, and that's a long head of triceps. Now you get three spaces here. This space, yes, can anyone answer what is this space? Upper triangular space. What's this space? That's a lower triangular space, and that's the quadrangular space. A very important MCQ. You get MCQs on boundaries of this quadrangular spaces, boundaries of this triangular spaces. You get MCQs on contents of the spaces. A very important thing. Can anyone answer what is the content of the upper triangular space? Look, someone has come here. Circumflex scapular artery is a branch of. It's a branch of subscapular artery, which is a branch of
third part of the axillary artery.
Third part of axillary artery, correct. What is this? I draw this as the spiral groove. I get an artery here and I get a nerve here. So what is this artery and what is this nerve which passes to the lower triangular space?
Profunda brachii
artery and the radial nerve, and what passes to this quadrangular space would be a nerve again and an artery. Sorry, that is gone. The nerve is what? The nerve is what? The nerve is going to be the axillary nerve and the artery is going to be the posterior circumflex humeral artery. Fine. So this is what you have to know, the spaces around the arm. The anatomical snuff box is another very important thing. Can anyone tell me what is the floor of the snuff box formed by? A straightforward MCQ.
Scaphoid and trapezium.
Scaphoid, trapezium and the styloid process of radius. Styloid process also forms the floor of the snuff box, the content of the snuff box. Another very important MCQ, content.
Cephalic vein.
Official branch of
radial artery is the content, right? The radial artery is the content, and who lies in the roof? Because students always mistake this. वो content में लिखते हैं superficial branch of radial nerve. No, that's not a content. Content is radial artery, and who lies in the roof? One is the superficial branch of radial nerve. Second, cephalic vein. Very good. That's cephalic vein. And you know, this superficial branch of radial nerve gets compressed here. A person complains of paresthesia and numbness on the area of the skin which is supplied by the superficial branch of radial nerve. What is this known as? Answer: compression of the radial nerve, your superficial branch of radial nerve at the snuff box. This is something very similar to compression of a nerve which emerges out at the most lateral aspect of the inguinal ligament. A very similar thing. Look, try to correlate. Compression of a nerve which emerges out at the most lateral aspect of the inguinal ligament.
So lateral cutaneous nerve of the thigh.
Perfect. Lateral cutaneous nerve thigh, and the compression of lateral femoral cutaneous nerve thigh against the inguinal ligament is known as what?
Meralgia paresthetica.
Meralgia paresthetica. Excellent. So this is something very similar, and this is what we call as C, chiralgia paresthetica. So chiralgia paresthetica is the compression of the superficial branch of radial nerve at the wrist. Okay, that's C, chiralgia paresthetica. So rest about the upper limb, the muscles you have to know, the deltoid. You tell me which is a boxer's muscle. Serratus anterior is supplied by, yes, very good. Serratus anterior is supplied by the long thoracic nerve, and this long thoracic nerve is very commonly damaged during surgeries like mastectomy. So once this long thoracic nerve is damaged, serratus anterior is paralyzed. What does the person complain of? One,
can't abduct the shoulder.
Overhead abduction is not possible.
Very good. Overhead abduction is not possible. It will be not possible, but trapezius is still there to do this overhead abduction, but it will not be to that extent. Something else. Yes, the winging of scapula. Winging of scapula, and winging of scapula is caused due to paralysis of two muscles. One is the serratus anterior, and second is trapezius. Trapezius steadies the scapula along the chest wall. So winging of trapezius also causes winging of scapula. You are a physician sitting in your clinic. A person walks in, says he's not able to abduct his shoulder joint above 90 degrees. You examine the person, you go behind, and you tell the person to touch the wall. You tell the person to push against the wall. What are you telling the person to do? So what are you testing? What are you testing? A person is pushing the wall. So what are you testing? You're testing the serratus anterior. You're testing the serratus anterior. Yes. And now suppose when a person is pushing the wall and now the person gets a winging of scapula. Yes, you know this is winging due to paralysis of serratus anterior. And a second person comes to your clinic. You are examining the patient. The patient is at rest. Okay, the person is at rest, and still you find a winging of scapula. Oh, you immediately come to a diagnosis. This is paralysis of trapezius. So winging at rest is trapezius, and winging on attempting movement is serratus anterior. Are you getting this? Fine. You must be knowing winging, you must be knowing overhead abduction, everything. I'm just putting a small topping on it. Winging at rest. Matlab the person is at rest and still there's a winging of scapula. This is due to paralysis of trapezius. And when a person begins a movement and you get a winging on attempting movement is due to serratus anterior. Following this, just remember all these things. Okay. Coming to the lower limb, you must be knowing some about the femoral triangle. Quickly tell me, what is the anterior wall of femoral sheath formed by? Come on students, anterior wall of femoral sheath.
Fascia transversalis.
Excellent. Posterior wall of femoral sheath is formed by?
Fascia iliaca.
Fascia iliaca. Baki three compartments you must be knowing: lateral, intermediate, medial. The medial compartment is empty, also known as femoral canal. The upper part of the femoral canal is known as the femoral ring. And who lies on this femoral ring? A lymph node. Name?
Lymph node of Clockett's.
Lymph node of Clockett's or Rosenmuller. And what is it drain? It drains the glans penis and the glans clitoris. Remember, the penis and the clitoris normally drains into the superficial inguinal lymph nodes, but the glans penis and glans clitoris drains into the deep inguinal lymph node. That's the lymph node of Cloquet or Rosenmuller. Just remember this. Now, if there's a femoral hernia, you just tell me what is the direction of the femoral hernia. How is it directed?
Lateral to the pubic tubercle.
Lateral and below the pubic tubercle. Very good. And how is the direction? Like if I have to reduce a femoral hernia, I will reduce because you have to know the direction of it. Only then you can reverse it in the opposite direction. You can reduce it going in the reverse direction. So it goes downwards, forwards and upwards. Very good. It goes downwards, forwards and upwards. So when you're reducing a femoral hernia, you go downwards, backwards and upwards. Right. So femoral hernia is below and lateral to the pubic tubercle. You compare this to inguinal hernia, which is above and medial to the pubic tubercle. Perfect. Right. So that's about the femoral sheath. And now suppose if there's a femoral hernia, you have to dilate the femoral ring. As a surgeon, yes, you are cutting one of the boundaries of the femoral ring. Which boundary do you cut?
Medial
Formed by
lacunar ligament.
Fine. You cut the lacunar ligament, you dilate the femoral ring, you reduce the hernia, you put a mesh. Very good. A very good surgeon you are. But you are extremely careful because sometimes on the lacunar ligament lies something. Abnormal obturator artery, which is a branch of. This you answer.
Epigastric.
Yes. Abnormal obturator artery is a branch of inferior epigastric artery, and damage to this artery would lead to hemorrhage. And this inferior epigastric artery is a branch of external iliac. Where else have you come across this inferior epigastric artery? Just that you have answered inferior epigastric artery, you can quickly tell me. See, as an MCQ aata na, before seeing the options, you should be able to analyze the stem of the MCQ. Like I get an MCQ on inferior epigastric artery. I try to analyze everything that I know about the inferior epigastric. One, it's a branch of external iliac. Where else have you come across inferior epigastric artery with respect to that triangle? Which boundary? Lateral boundary. An inferior epigastric artery is going to distinguish between two hernias. A hernia lateral to it is going to be. नहीं समझ में आया. Inferior epigastric artery is going to differentiate.
Indirect hernia.
So hernia going lateral to the inferior epigastric artery is going to be an indirect, and a hernia going medial to the inferior epigastric artery is going to be a direct inguinal hernia. That's about the inferior epigastric. This inferior epigastric artery is going to anastomose with the superior epigastric artery in the rectus sheath. And there are two branches of inferior epigastric artery. One which I've just told you, an abnormal obturator artery. The second, if you can answer this. Second branch of inferior epigastric artery would be. सोच सकते हो? थोड़ा difficult है. It's difficult. Answer. Something from C. An artery which begins from C. Cremastic artery. Excellent. Very good. Very good to all of you. Cremastic artery is the second branch of inferior epigastric. So fine. So that femoral triangle you have to know. Adductor canal you have to know. Can anyone tell me the contents of adductor canal? Contents. Just the contents. One, femoral vessels. Second.
Nerve to vastus medialis.
Nerve to vastus medialis. Third. Saphenous nerve. Fourth. The posterior division of obturator nerve. Posterior division of obturator nerve. Okay, so then you have to know the adductor canal. You should be able to draw the adductor canal if it comes as a SAQ or answer in brief. And you have to know the contents of the adductor canal. Very good. Popliteal fossa is very easy. I'll just quickly brief about the leg. If you can tell me which is the nerve of the posterior compartment of the leg. Nerve of the posterior compartment. Yes, tibial nerve. No, tibial nerve. Leg. See, there's now plenty of MCQs you get on the legs, students. You should be very clear. Just give me 5 minutes. The nerve in the posterior compartment of the leg is tibial. Nerve in the lateral compartment of the leg. Answer this. Lateral compartment. Superficial peroneal, and the nerve in the anterior compartment of the leg is the deep peroneal nerve. Right, the muscles in the anterior compartment, I'll just enumerate. 1, tibialis anterior, the extensor hallucis longus, the extensor digitorum longus, and peroneus tertius. If anyone can tell me what is the action of all these muscles of the anterior compartment of the leg, what do they do? This. Dorsiflexion. And if the deep peroneal nerve is damaged, dorsiflexion is lost, the foot goes down. What's this? Foot drop. So when such a person walks, this foot is going to be normal. This foot rubs against the ground. The person lifts this foot to a very high level and he puts it down. So what is this gait known as?
Slapping foot?
It is known as a high stepping gait. It is known as a stamping gait. Or it is also known as the marching. You seen soldiers? Marching gait. A very, very important MCQ. Foot drop is a SAQ for you. So this you have to be very clear about. The lateral compartment of the leg, the muscles, peroneus longus, peroneus brevis, nervous superficial peroneal nerve, action, what is this?
Plantar flexion.
Eversion. This is eversion of the foot. Okay. And posterior compartment, muscles, superficial and deep. This should be there very perfectly in your brain. No confusion, because I've seen students getting confused in the compartments of the leg, in the nerve supply, the arterial supply of the leg. So be very clear. Posterior compartment, superficial muscles. One is gastrocnemius, soleus and plantaris. What is the action of them? Plantar flexion. The deep muscles, one is popliteus. What is the action of popliteus? Unlocking. Second muscle. Very good. Second muscle is tibialis posterior, the flexor hallucis longus, the flexor digitorum longus. And these three deep muscles, what do? They do plantar flexion, and they are very powerful. What is this? Inverters. So tibialis posterior, flexor hallucis longus, flexor digitorum longus, very powerful inverters and plantar flexors. Okay. So MCQ, a person comes to you and the person is not able to stand on the tip of his toes. What do you suspect? Person is not able to stand on the tip of his toes. That means which action is lost? Try to think in this way. See, as a book se padhoge, you know plantar flexion is lost. Which is the compartment responsible for plantar flexion? Posterior compartment. So which is the nerve damaged?
Tibial.
Very good. So try to analyze like this, students. Its anatomy is one of the best things to understand, and if you understand, you will love the subject. I just love teaching anatomy. Okay, so that's how it is. So these are the compartments of the leg. Can anyone tell me the artery in the anterior compartment? Artery in the anterior compartment.
Anterior tibial artery.
Anterior tibial artery. Artery in the posterior compartment is posterior tibial. Both of these are branches of anterior and posterior tibial are branches of popliteal artery. Very nice. And there's no separate special artery for the lateral compartment. So someone has to give this artery to the lateral compartment. The posterior tibial artery gives an artery. This artery is related to the crest of the fibula. This artery, the fibula looks like a pin known as peroneal. The artery is known as peroneal artery. So answer, peroneal artery is a branch of
Posterior
tibial artery. Perfect. Okay. And then about the venous drainage of the foot that you have to know. Venous drainage of the foot aana chahiye aapko. And then you have to know about the arches of the foot. Arches, the medial and the lateral longitudinal arches and the support of these arches. Can anyone tell me spring ligament is going to support which arch of the foot?
Medial longitudinal
arch. Okay. Medial longitudinal arch is the spring ligament. The other name for spring ligament is the plantar calcaneonavicular ligament. Plantar calcaneonavicular ligament, it supports the head of the talus. And which are the two ligaments which are going to support the lateral longitudinal arch? Is the short and the long plantar ligament. And this support is known as the intersegmental tire. Intersegmental tire. मतलब ये जो bones होता है ना arches में, there are say 5-6 bones. Each of these bones acts as a segment. This is one segment, this is second segment, third segment, fourth segment. And who's going to tie all the segments together? These are the ligaments. And this support is therefore known as an intersegmental tire. वो टायर का मतलब समझता नहीं है. टायर इज नॉट MRF टायर, इट्स अ टायर, TIER, टायर. Okay, so intersegmental tire, spring ligament and the short and the long plantar ligaments. Okay, So coming to the thorax, you have to know something about the intercostal space. A very important LAQ, students, very important LAQ, intercostal space. So you write about the muscles, you write about the anterior intercostal vessels, posterior intercostal vessels, the arteries and the vein, and the last you write is about the intercostal nerve, right? Okay, fine. Just one moment. If you can quickly tell me, see, this is so nice and this is extremely important MCQ. Right, if you can quickly answer this, veins. This is a deep vein inside the neck. A fast, a quick revision. These are the T2 veins deep inside the neck. Name. Internal jugular vein. These are the two. These are the two veins coming from the upper limb, the subclavian vein. One coming from the cephalic region, one coming from the brachium. This is now known as what? What is this? This is the right brachiocephalic. This is the left brachiocephalic. The left is longer, joins with the right, forms what? What is this? SBC. And there's a single unpaired vein here. Who's this?
Azygous.
Excellent. Azygous vein. That's the azygous vein. A single unpaired, therefore known as azygous. I'm just telling you the posterior intercostal vein, children. If you can tell me the first right posterior intercostal vein drains into what? What is that? The first right brachiocephalic. A very important MCQ. बहुत important MCQs है ये. The first right posterior intercostal vein drains into right brachiocephalic. The first left posterior intercostal vein drains into left brachiocephalic. Second, third, and fourth right posterior intercostal vein joins to form a vein. Can anyone tell me what is the name of this vein?
Intercostal.
Right superior intercostal vein drains into what? Azygous vein. Second, third, and fourth on the left side joins to form the left superior intercostal vein drains into the left brachiocephalic vein. Another very important MCQ. अब इसके बाद जितने भी veins हैं on the right side they drain into what? Azygous. On the left side 5, 6, 7, 8 joins to form. What's that?
Accessory hemiazygous.
Accessory hemiazygous. Very good. Accessory hemiazygous. You be prepared. Then we'll be having a quiz now. I'll be taking Viva specifically of the 3 toppers. फिर देखते हैं. You are answering very well. So you will get very good ranks there also. So let us see. 5, 6, 7, 8, 9, 10, 11, 12. Very nice. Tell me what is this now? What is this going to be?
Hemiazygous.
Very good, perfect. Hemiazygous vein, and that's accessory hemiazygous. Both of them they drain into azygous. So azygous vein comes as a short note for you. You write how it begins, where it drains into. You write the tributaries of azygous vein, and these are all the tributaries of azygous vein. Okay. Can anyone tell me which are the typical intercostal nerves? Typical intercostal nerves. Can anyone answer?
2 to 6.
Yes. Which are the typical intercostal nerves?
Third to 6th.
3 to 6. 3 to 6. 3 to 6 nerves are typical intercostal nerves. 3 to 6. Right. The typical intercostal nerves क्या होते हैं? The one which supplies the intercostal muscles, the one which supplies the skin on the anterior aspect of the chest wall, and the one which supplies the skin on the lateral aspect of the chest wall. अगर इतना supply करते का, it is known as a typical intercostal nerve, right? One is the intercostal muscles, second is the skin on the anterior aspect of the chest wall through anterior cutaneous branch, and the skin on the lateral aspect of the chest wall through the lateral cutaneous branch. This much if it supplies, it is typical. Anything extra, if it supplies anything extra, it would be known as what? Atypical. Tell me why is T1 atypical?
It supplies the brachial plexus.
It joins the brachial plexus. It joins the brachial plexus, right? It joins the brachial plexus and it supplies the upper limb. T1 specifically supplies the small muscles in the hand. जो intrinsic muscles of the hand होते हैं ना, that is specifically supplied by T1. And this T1 is mainly concentrated in the median and ulnar nerves. And this T1, when it is involved, you get this claw hand with paralysis of all the small muscles in the hand. Name the syndrome, or name the paralysis.
Clunky's
paralysis. Excellent. Clunky's paralysis, जिसमें involvement of C8 and T1 होता है. The lower trunk of the brachial plexus is involved, and that's how we get this claw hand and paralysis of this intrinsic muscles of the hand, right? So T1 is atypical. What happens to T2? Can anyone answer this? T2 is atypical.
The lateral cutaneous branch between the intercostal arm, which separates the shoulder.
Wow. Right, Shita, students are very nice. Your students are really good. Okay, so the lateral cutaneous branch of second intercostal nerve joins with the medial cutaneous nerve arm, and this is what we call as an intercostobrachial nerve. The second nerve, which is very commonly damaged during mastectomy. Remember, two nerves are damaged. One is intercostobrachial nerve and the other one is the long thoracic nerve. These two nerves are damaged during mastectomy. तो जैसे MCQs आते हैं वैसे आपको options देके answer करना है. The rest of the intercostal nerves, 6 के नीचे, what else do they supply for which we call them as atypical? They supply
Anterior
Abdominal wall.
muscles of the anterior abdominal wall. Muscles of anterior abdominal wall. So an intercostal space is an LAQ. And students, I always tell, when you prepare one LAQ, there are many SAQs that you automatically prepare. Like you can get intercostal nerve as a short note, as a intercostal muscles as short notes. Okay, so that's it about the heart. So you must be knowing the grooves and the various coronaries also. Tell me, how is the coronary sinus formed? Can anyone answer this? Coronary sinus.
Coronary... left horn and body of sinus venosus.
No, I'm not asking embryo. I'm not asking embryology. I'm asking gross. How is the coronary sinus formed? एक minute. Just one moment. Okay, you're all very nice. Chalo, tell me, what is this chamber of the heart? The right atrium, the right ventricle, the left ventricle. What is this groove? This is an anterior atrioventricular groove. I'm going back side. What is this groove? Answer this. ये क्या groove है? पीछे.
posterior atrioventricular.
Posterior atrioventricular groove. This is an anterior interventricular groove. I go down. What is this groove? This is going to be the posterior interventricular groove. This is the pulmonary trunk and this would be the arch of aorta. Fine students, just tell me, what is this surface of the heart that I'm looking from front? ये surface जो सामने से देख रहे हो, what is that surface? This surface that you're looking from front is lying behind the malleolum sterni, the body of the sternum and the costal cartilage. We therefore call this as the sternocostal surface. And MCQ comes for you, sternocostal surface of the heart is made up of which chambers? The right atrium, the right ventricle and the left ventricle. That forms the sternocostal surface. But suppose one out of this three you have to select. What do I select? The right ventricle. The right ventricle, because that forms a major part of the sternocostal surface. What is this for the heart? Anyone?
Apex.
Exactly, पीछे जाइए. Exactly behind this much part about this groove from backside is going to be what? This much part from behind is the base and this much part from below is the diaphragmatic surface of the heart. Diaphragmatic surface, अगर heart को side से देखते हो, side view से, so this is the sternocostal surface, that's the base and that's the diaphragmatic surface of the heart. If I turn the heart like this, if I turn the heart and I'm looking the heart from back side, I see something like this. What is this groove? This is nothing but the posterior atrioventricular groove. And what is this groove? Posterior interventricular groove. So what is this surface of the heart? Base. ये turn की heart को. So this is the base from back side. If I turn the heart, that's the base. And what is this surface? Diaphragmatic surface. Fine students, I just want what artery and what vein lies in this groove. The anterior atrioventricular groove. Artery. Come on. Artery. Anterior atrioventricular groove. Yo. Which is the artery
Right
here?
coronary artery.
That's the right coronary artery here. That's the right coronary artery here. And what's the vein? Vein?
Middle.
No.
Great cardiac marginal.
No. What's the vein? Come on, answer. यहाँ पे एक vein होती है इसके साथ. This is the small cardiac vein. Small cardiac vein. So this is the right coronary artery and the small cardiac vein. ठीक है? Tell me students, what is this artery here? What is this artery here? In the anterior interventricular sulcus of the heart. What is this artery?
Anterior interventricular
branch of left coronary, also known as LAD, the left anterior descending artery. Now this left anterior descending goes in this groove. That's a posterior interventricular groove. What is the vein here? Vein बोल सकते हो इसके साथ जो vein होता है?
cardiac vein.
Very good. That's a great cardiac vein here. The great cardiac vein will join with a vein coming from the margins. Name. Marginal vein. And now this two will join to form the largest vein of the heart. Can anyone tell me what is this biggest vein of the heart?
Coronary sinus.
The coronary sinus. So you get an MCQ. Coronary sinus is formed by Gross, I'm asking gross, it is formed by the joining of two veins. One is the great cardiac vein and the second one is the marginal vein. And this coronary sinus lies in which groove of the heart? What is that groove?
Posterior atrioventricular.
Posterior atrioventricular groove, and this groove is therefore known as the coronary sulcus. Coronary sulcus. अगर आप books में देखोगे ना, all these grooves are labeled as coronary sulcus. But coronary sulcus ideally is the one in which the coronary sinus lies. MCQ is coronary sulcus is, your answer, the posterior atrioventricular groove. Posterior atrioventricular groove. Fine. So that's how the coronary sinus is formed. Just complete this. Tell me which is the vein which lies here in this groove. What is the vein lying here?
Middle cardiac vein.
Middle cardiac vein. That's the middle cardiac vein. So this is the small cardiac vein. This is the great cardiac vein. That's the middle cardiac vein. And what is this vein here? That's the coronary sinus. Coronary sinus of the heart. Clear? Okay. Tell me which is the artery which decides the cardiac dominance of the heart? Which is the artery which decides the posterior interventricular artery. Posterior interventricular artery. This is the right coronary artery. The right coronary artery now runs in the posterior atrioventricular groove. It gives a branch. This is the posterior interventricular artery, and this posterior interventricular artery is going to determine the cardiac dominance. If this is a branch of right coronary, this is what we call as the right coronary dominance. If it's a branch of circumflex, ये कौन सा branch है? This is the circumflex, है ना? So if it's a branch of circumflex, it is left coronary dominance. If both give this branch, it is known as what? A co-dominance. Co-dominance. Fine now, Ikshita, this is fine. Are you all following this? Enjoying? Understanding? Okay. Fine. Just tell me, which is the first primitive chamber of the heart? The primitive chamber of the heart. I'm just asking you this. Can anyone answer this? The primitive chamber of the heart. मतलब ये जो first chamber होता है ना, fetal heart में embryologic heart. हाँ, ये पहले bulbous cordus था, बाद में इसका truncus arteriosus बनता है. Truncus arteriosus, ventricles, atria, and what are these? Sinus venosus. Tell me, in this truncus arteriosus, a septum is formed. Name.
Aorticopulmonary septum.
Spiral septum, very good. Aorticopulmonary septum, it is also known as, and this septum is going to divide the truncus arteriosus into two big blood vessels, an ascending aorta and a pulmonary trunk. And who's going to migrate into this septum, the aorticopulmonary septum? Who's going to migrate into this?
Neural crystals.
Very good. The neural crystals migrate into this septum, and this septum is formed right in the midline. So ascending aorta and pulmonary trunk are of the same size. Suppose if the neural crystals do not migrate into this, you get defects of this. This one defect I'll tell you. The first defect, this septum है ना midline में नहीं बनता. This septum is shifted to the right side. The septum shifts anterior and to the right. So one vessel becomes very small. Who's small? The pulmonary trunk becomes very small and the ascending aorta becomes very large. Understand? So the septum is shifted to the right side. So a small pulmonary trunk, we call this as the pulmonary stenosis. Pulmonary stenosis. And because of pulmonary stenosis, the right ventricle will contract, leading to a right ventricular hypertrophy. Because of this right ventricular hypertrophy and the pressure, there's an interventricular septal defect. And students, which part of the septum, interventricular septum, is always defective? Membranous. दो parts होते हैं, हाँ दो parts होते हैं, muscular and membranous part. तो membranous का defect होता है. There's a membranous interventricular septal defect, and the moment there's a membranous interventricular septal defect, the aorta will just come and ride over the interventricular septum, and this is what we call as overriding of aorta. So what is this condition? Perfect. TOF, tetralogy of Fallot. So what is the prime cause of TOF? Pulmonary stenosis. ठीक है ना? Prime cause of TOF is pulmonary stenosis. Because of pulmonary stenosis, RVH. Because of RVH, a septal defect. And because of septal defect, you get an overriding of aorta. So this is what is known as TOF. And this is due to the shifting of the aorticopulmonary septum to one side, to the right side. So that's how the pulmonary stenosis is. So this all things are very important, because iske baad when you enter into this clinicals, you'll be requiring all this, and your base has to be very clear. Anatomy is a base for everything. If your basic subjects are clear, you'll enjoy the clinical subjects. Have confidence on the basic subjects, then automatically have confidence on the clinical subjects as well. Okay, so that's about the heart. Okay, that's it. So tell me now, students, lumbar plexus. एक lumbar plexus बोल सकते हैं. I'll just show you one slide of the lumbar plexus. Just one moment. I'll just show you one slide of lumbar plexus. If anyone can identify what is this nerve. एक minute. I'll just put a point for you. Yo, what is this nerve? You know, visuals are very important. बच्चे लोग, visuals are very important.
Iliohypogastric.
Iliohypogastric.
This is iliohypogastric. What is this nerve?
Ilioinguinal.
This is the ilioinguinal nerve, and this is a branch of lumbar plexus, and this is what I was telling you. This nerve comes at the most lateral aspect.
Lateral cutaneous.
Lateral cutaneous nerve of thigh. Compression of this leads to myalgia parasitica. And look, there's someone hiding inside this groove here. What is this? Iliacus psoas major. A very common MCQ, nerve lying in the iliopsoas groove. What's this, students? ये nerve कौन है?
Femoral nerve.
Femoral. That's a femoral nerve in the iliopsoas groove. I have to search the femoral nerve. So if you just know femoral nerve lies in the iliopsoas groove, just search for the psoas major. Uske lateral जाओ, the femoral nerve has to be there, right? The nerve lying on the psoas major. Can anyone answer this? This is another extremely important. Genitofemoral nerve. Excellent. The genitofemoral nerve is a branch of lumbar plexus, divides into a femoral branch and genital branch. The femoral branch of genitofemoral nerve enters where? Where does it go?
Lateral compartment of femoral sheath.
Lateral compartment of femoral sheath along with the femoral artery. The genital branch of genitofemoral nerve enters the spermatic cord in males or the round ligament of uterus in females, right? And if you remove these vessels, behind these vessels, medial to the psoas is going to be the obturator nerve. Clear? So what are the branches of lumbar plexus? देखो, iliohypogastric, ilioinguinal, the lateral cutaneous nerve thigh, the femoral, the genitofemoral, and इसके पीछे होगा obturator nerve. Then who's this?
Subcostal nerve.
Subcostal nerve. T12.
Subcostal, T12, and the T12 nerve comes in the abdomen. ये thorax में होता है ना, T12 है ना, तो ये thorax में होता है, and it comes in the abdomen behind this ligament. What we call this as the lateral arcuate ligament. इसे बोलते हैं lateral arcuate ligament. And who comes below the lateral arcuate ligament? That's the subcostal nerve. And what do you call this as? Students, can you answer this? ये कौन है? ये ligament. This one. Medial arcuate ligament, and there's someone who's coming behind the medial arcuate ligament. Look at this. ये कौन है? The sympathetic chain. Sympathetic trunk. Extremely important MCQs. Extremely important. So sympathetic chain comes behind the medial arcuate ligament. The subcostal nerve and vessels comes behind the lateral arcuate ligament. And why this arcuate ligament is so important for us? Because the medial and the lateral arcuate ligament gives origin to a muscle. Name. Diaphragm. Beautiful. Diaphragm. Yep, that's a diaphragm. The diaphragm arises from the medial and the lateral arcuate ligament. The diaphragm also arises from the bodies of the lumbar vertebrae. What do you call this part of the diaphragm as? Crus of the diaphragm. Perfect. Crus of the diaphragm. Can anyone tell me the right crus of the diaphragm is related posteriorly to an organ? Now this is an MCQ. It's difficult, but you can give a try. The right crus of the diaphragm is related to an organ. Posterior. Kidney ne.
Suprarenal.
यहाँ तक आता है kidney. Suprarenal भी नहीं है. And something else. Someone said this. Pancreas. Which part of the pancreas?
Body of the pancreas.
Body नहीं बच्चा, body नहीं.
Head of the pancreas.
Head of the pancreas. Head आता है यहाँ पे. So the head of the pancreas का posterior relation is going to be the right crus of the diaphragm. Also, when I'm telling you the head, I should tell you the head is also posteriorly related to a tubular structure. Can you answer this?
Bile duct.
Inferior vena cava.
Inferior vena cava is fine. A small tubular structure. It comes
Superior mesenteric.
Superior mesenteric is body of the pancreas. No, एक minute. A small tubular structure which lies behind the head of the pancreas, which opens in the second part of duodenum. That's it.
Common bile duct.
Bile duct.
That's a bile duct. The bile duct lies behind the head of the pancreas, and the part of the pancreas which is more prone to CA, cancer, is the head of the pancreas. And when there's a C of the head, the bile duct gets compressed, the person gets an obstructive jaundice. A very important clinical MCQ for you. Okay. So that's about the head of the pancreas. Whereas the left crus of the diaphragm is related to the stomach bed as well as the body of the pancreas. Body के relation में आता है left crus. Right crus is in relation to the head of the pancreas. Clear to all of you? Okay. So that's about the artery. That's about the lumbar plexus. Students, I'll just do one thing. I'll just give you an orientation about this. Something which is very important. Can anyone tell me now? What is this for the pelvis? एक छोटा सा orientation देता हूँ. First, tell me what is this. If this gets clear, now your entire concepts will get clear. What is this for the pelvis? This
Tinea terminalis.
that is also known as the pelvic inlet or the pelvic brim. So, and this pelvic brim divides the pelvis into a true pelvis, and this is what we call as a false pelvis. Correct? Now we draw a line from the pubic symphysis to the ischial spine. We draw a line from the pubic symphysis, we come behind, we reach the ischial spine, and this line on both the sides is known as the white line of pelvic fascia. The white line of pelvic fascia, or the tendinous arc of the pelvic fascia. What is this? A line drawn from the pubic symphysis on either sides comes to the ischial spine, and this is the line which gives origin to a muscle. Now half muscle comes from here, half comes from here, and here it is going to interdigitate.
Levator ani.
Levator ani. Yes, very good. That's the levator ani. Understand this, students. So this is the levator ani, and this levator ani is going to divide our true pelvis into two parts. A part above the levator ani is what we call as the pelvis proper, and a part below the levator ani is what we call as, anyone?
Perineum.
Perineum. Excellent. So that's the perineum. So what divides the true pelvis into a pelvis proper and a perineum? That's the levator ani. Levator ani. Okay. So just have a look at the slides now. Yeah, have a look. So what is this line? This is the line which I'm telling you. What is this line? That's the white line of pelvic fascia. What is this muscle here? Levator ani. So what are we looking into? क्या देख रहे हो आप? You're looking from up. So you're looking into what? The pelvis proper. Pelvis proper. Suppose if you look from the opposite side से देखोगे तो this is what you look at. What is this now?
Pelvic diaphragm.
No, that's fine. So what is this area? Perineum. That's a perineum. समझ में आ रहा है? मतलब ये levator ani के ऊपर ये who's this? Pelvis proper, and below the levator ani this is going to be the perineum. So levator ani is going to form the floor of the pelvis proper. The same levator ani is going to form the roof of the perineum. Perfect. Now just tell me one thing. Any structure. Tell me what is this ligament? ये क्या ligament होता है?
Sacrotuberous ligament.
Sacrotuberous ligament is a degenerated part of a muscle. Can anyone answer this? Which muscle is that?
Gluteus maximus.
Not gluteus maximus. Not gluteus maximus.
Biceps femoris.
Which head? Which head of biceps femoris? The long head of biceps femoris. वैसे ना the lower limb के posterior compartment में जो hamstrings है ना, that is another extremely important thing. Hamstrings, I forgot to tell you. Hamstrings, you have to know the criteria to call a muscle as hamstrings. Second, you have to know the gluteus medius and minimus, what is Trendelenburg sign, and how they lift the pelvis when one foot is off the ground. How they prevent the falling down of the pelvis. Okay, can anyone tell me what is the nerve supply of gluteus maximus?
Inferior gluteus.
Right, very good. So this is the sacrotuberous ligament, and that's the sacrospinous ligament. What is this notch here? Greater sciatic notch. The lesser sciatic notch. The sacrotuberous and the sacrospinous ligaments converts this notches into foramens. This is what we now call as the greater sciatic foramen, and this is what we call as the lesser sciatic foramen. Look, this is so nice. The levator ani is attached in such a way that one goes up and one goes down. So where's the greater sciatic foramen gone into what? The greater sciatic foramen is now into
Pelvis
what?
proper.
Pelvis proper, and the lesser sciatic foramen is down into the perineum. Are you following this? Greater sciatic foramen has gone in the pelvis proper, lesser sciatic foramen has come down into the perineum. Okay, now you tell me, if any structure from the pelvis, ये levator है, any structure from the pelvis, अगर उसको बाहर जाना है, it has to get out. There are 3 ways it can get out. 1, what is this that I've drawn?
Inguinal ligament.
Inguinal ligament. Suppose if a structure goes below the inguinal ligament, the structure is straight down into what?
Anterior compartment of thigh.
Perfect. Very good. It is right into the anterior compartment of the thigh. And this is what exactly the external iliac does, right? So the external iliac goes below the inguinal ligament and now it continues as the femoral artery. The femoral nerve also goes below the inguinal ligament. The second option, the structure comes down and gets out from here. What's that foramen?
Obturator foramen.
The nerve is obturator nerve, and the moment it gets out from here, where is the structure? Now into the medial compartment of the thigh. But a majority of structures will get out through the greater sciatic foramen, and the moment the structure gets out through the greater sciatic foramen, यहाँ से अगर हम बाहर जाते हैं, the moment the structure gets out through the greater sciatic foramen, look, it has come out through the greater sciatic foramen. Where's the structure now?
Gluteal region.
Okay, so the structure is right into the gluteal region. Understand this concept, and this is extremely important. मतलब कोई भी structure अगर greater sciatic foramen से बाहर निकलता है, where is it gone? Into gluteal region. Now the structure has got 3 options. उसके पास 3 options है. 1, it remains in the gluteal region. Tell me examples of this structure which remains in the gluteal region. Answer.
Superior gluteal nerves.
Very good. Superior gluteal nerves and vessels, the inferior gluteal nerves and vessels, the piriformis muscle. All the structures get out through the greater sciatic foramen, they remain in the gluteal region. The second option for this structure, the structure goes straight down. Where are we?
Posterior compartment of thigh.
Perfect. We are right into the posterior compartment of the thigh. And who does this?
Sciatic nerve.
Sciatic nerve. Posterior
Sciatic nerve
cutaneous nerve.
and the
thigh.
posterior cutaneous nerve of the thigh. Very good. You're answering very well. The sciatic nerve and the posterior cutaneous nerve of thigh. Or one last option the structure has. Ek minute, I'll just clear the ink. One last structure. The structure gets out through the greater sciatic foramen. It turns around the ischial spine, and the structure now enters the lesser sciatic foramen. The moment it enters into the lesser sciatic foramen, the structure is right into the perineum.
Perineum.
Understand? See, pelvis से अगर perineum में जाना है ना, you can't go straight down into the perineum. The levator ani is there in between. So what does the structure do? The structure gets out through the greater sciatic foramen and now enters into the perineum through the lesser sciatic foramen. And how will the structure do this? Like if a structure is going like this, how does it change its direction and again go like this in the reverse direction? There has to be something, like there's a pole and you're hanging and you suddenly turn around the pole. That means there's something around which the structure winds around, hooks around.
Ischial spine.
Ischial spine. Perfect. And these are the 3 structures which winds around the ischial spine. A very important MCQ for you. This is what we call as the pin. Who's P?
Pudendal nerve.
Pudendal nerve. I. Internal pudendal vessels. It's like this, and N is the nerve to obturator internus. एक बार एम्स में ऐसे भी MCQ आया था, which is the most medial structure on the ischial spine. ऐसे भी MCQ आया था. So that's pudendal nerve. सबसे medial pudendal nerve, then the internal pudendal vessels, and then there is the nerve to obturator internus. So now in the perineum, which is the nerve of the perineum? Pudendal nerve. Which is the artery of the perineum? The internal pudendal artery. So any nerve, any vessel of the perineum has to be a branch of pudendal nerve and the internal pudendal artery. That's it. I hope you've got an orientation to this pelvis perineum. Okay, how the pelvis is, how the perineum is, and about the levator ani. And look at this. This is a side view. That's the levator ani. So that's the pelvis proper. And what is this big pear-shaped muscle which is getting out?
Piriformis.
That's the piriformis. Okay, look, this is beautiful. That's the levator ani. So what is this? This is the pelvis and this is the perineum. Who lies in the pelvis proper? The bladder. I'll show you another slide for this. That's the levator ani, that's the pelvis proper, that's the perineum. The bladder, the uterus, the rectum, they line the pelvis proper. And who's going to pierce the levator ani and go down? The urethra, the vagina and the anal canal They therefore lie in the perineum. Okay. Is this clear to all of you? Right. And just quickly tell me, Ipshita, just tell me the time. Ipshita, you there now?
Yes, sir, it's 6:25.
You tell me when I have to stop. Like I'll keep on talking.
Well, we don't have any issues, we're enjoying.
Okay, students, you tell me when you're exhausted. I can keep on talking. Okay, look. I'm just drawing a sagittal section for you. Another extremely important, concept to be understood. I've drawn a sagittal section. That's the lever. What is this? Can anyone tell me? ये क्या हो सकता है? That's the stomach. What's this? Transverse colon. And ये कौन है? Pancreas. Now I'm not going into that details. मैं बस ये directly draw किया नहीं था. It will take more time. Okay, I'm drawing a sagittal section. Stomach के पीछे होता है transverse colon के पीछे होता है pancreas. Just the important things that I've drawn. That's the diaphragm and that's the lever, and this part of the lever is fixed to the diaphragm. What do you call this as? Answer.
Bare area of lever.
Bare area of lever. Very good. Bare area of lever. I start. Here we begin. We start from the lever. We come down. Who are we?
Lesser omentum.
Lesser omentum. The lesser omentum comes down, splits, encloses the stomach. Now the lesser omentum goes down. Who are we? Greater omentum. The greater omentum now turns, and again comes up, encloses the transverse colon here. What is this known as? इसे क्या बोलते हो? This peritoneum. Perfect. Transverse mesocolon. The peritoneum enclosing the transverse colon is known as transverse mesocolon. So the stomach, the transverse colon are completely enclosed by peritoneum. Such organs which are completely covered by peritoneum are known as intraperitoneal organs. And they move with respiration. The peritoneum now comes back and splits over the pancreas, and that's how the pancreas goes behind the peritoneum. We call this as a retroperitoneal organ. We trace this layer of the peritoneum on the posterior abdominal wall. We go up to the diaphragm. We can't cross this. We come back to the liver. How beautiful. What is this?
Lesser sac.
That's the lesser sac. That's how the lesser sac is formed. Okay, I trace the second layer of peritoneum. I go down over the posterior abdominal wall, and again, who's that? Small intestines. And what is the peritoneum covering the small intestines? Known as mesentery. The peritoneum goes down, gives an inverted V-shaped mesentery. What is this inverted V-shaped mesentery for? ये कौन सा organ है जिसका inverted V? Sigmoid colon. And this is what we call as the sigmoid mesocolon. The peritoneum now goes down. Here we are in the pelvis. The peritoneum now covers the rectum, covers the uterus, covers the bladder, and all these organs are just below the peritoneum. And such organs which are below the peritoneum are known as the subperitoneal organs. So we classify it as intraperitoneal, retroperitoneal, and the subperitoneal organs. The peritoneum now comes to the anterior abdominal wall. That's the umbilicus, and we go straight up to the diaphragm. Here we can't cross this. We come back to the liver. Look how nice. ये देखो कौन है? Who's this? That's the greater sac. That's the greater sac. And if I just label this as the rectum, the uterus, and the bladder, and we get a small foramen here. You get a small foramen here behind the lesser omentum. That's the epiploid foramen. Perfect. So tell me, what is the anterior boundary of epiploid foramen formed by? The lesser omentum. And this lesser omentum contains three structures. One,
portal vein.
The hepatic artery, the portal vein, and the bile duct. Very good. And immediately behind this, behind the epiploid foramen, is a big vein. IVC, yes. The superior boundary of epiploid foramen will be formed by a lobe of the liver.
This is a
Caudate lobe of liver. Caudate lobe. And the inferior boundary of the epiploid foramen is formed by the first part of duodenum. First part of duodenum. मैं वो slide दिखाता हूँ आपको. So this becomes the greater sac, this becomes the lesser sac, that becomes the epiploid foramen. Tell me, what is this pouch known as? Recto-uterine pouch, also known as the pouch of Douglas. And this is the utrovesical pouch. Okay, so that's how the peritoneum is. Okay, now, एक मिनट. fine. So if you can just quickly tell me, what are we looking into? We've opened the anterior abdominal wall, children. We have opened the anterior abdominal wall, and what is that we are looking into? Don't tell me. Don't tell me abdomen. The students put the abdomen. You open the anterior abdominal wall and you are into the abdomen. Yes, we are into the abdomen, but we are right into the greater sac. Yeah. So this entire area that you're looking is nothing but greater sac. ये greater sac ही देख रहे हो, समझ रहे हो ना? That slide is gone now. I can't show you the slide again because ये anterior abdominal wall है and this organ. So this is the greater sac. So look at this arrow. What is this arrow indicating? This foramen, that's the epiploid foramen. So if you go through this epiploid foramen, you're right behind it. You're right into the lesser sac. Huh? So just understand this. If you can see the slide, this is a beautiful slide. Look at this. Tell me, that's the stomach. And look, what is this cavity? ये transverse section है, transverse section. Tell me, ये क्या है?
Lesser sac.
That's a lesser sac. Stomach है ना? You can see the space here. That's a lesser sac. And who's behind the lesser sac? The structures which are going to form the stomach bed. Or in other words, हम लोग कैसे बोलते हैं? The stomach is separated from the structures forming the stomach bed by lesser sac. तो ये है lesser sac. And what is all this space? ये देखो, all the space. What is all this? That's the greater sac. ये greater sac है. And now look beautiful from the greater sac here. I have to come into the lesser sac, and this is going to be the epiploid foramen. That's the epiploid foramen, जिसका anterior boundary would be formed by the free margin of the lesser omentum containing hepatic artery, portal vein, and bile duct. The posterior boundary would be formed by IVC. ऐसे slides देखो, the more you see the slides, the more your concepts are going to be clear. And then, everything is there in the slides. Can anyone tell me what is this? ये कौन है ये?
Gastrosplenic ligament.
Gastrosplenic, perfect. And what is this ligament?
Linorenal
ligament. Incidentally, the gastrosplenic ligament and the linorenal ligament are going to form the boundaries of the lesser sac. They're going to form the right boundary of the lesser sac. And spleen, this was an AIMS MCQ some years back. The spleen projects into which part of the peritoneal cavity?
Greater sac.
Greater sac. Yeah, the spleen projects into the greater sac, whereas the gastrosplenic and the linorenal ligament forms the boundaries of the lesser sac. Can anyone tell me, this is another very important MCQ, contents of the gastrosplenic ligament?
Short gastric vessels and left gastroepiploic artery.
Short gastric vessels and the left gastroepiploic artery. And what are the contents of linorenal ligament? The splenic
Tail of pancreas.
Tail of pancreas and the splenic vessels. How do you remember this? Look, the tail of the pancreas, the splenic artery lies in the linorenal ligament. Okay? Splenic artery is the content of linorenal, and जो branches होते हैं ना splenic artery के, the one going up, one going down, the short gastric and the left gastroepiploid, they lie in gastrosplenic ligament. That's how you remember. That's the easiest way to understand this. Okay, fine. So that's about the. Can anyone tell me what is this that I'm pointing? Yo. What's this that I'm pointing? Yeah, very nice. This is what I'm pointing is the root of mesentery. Matlab, this is the attachment of mesentery to the posterior abdominal wall. Can anyone tell me what is the extent of root of mesentery? It extends from
right sacroiliac joint to DJ flexure.
Yes, very good. It extends from the DJ flexure. Flexure to the right sacroiliac joint. It extends from the DJ flexure to the right sacroiliac joint. And what are the structures crossed by the root of mesentery? A very important MCQ. A very important.
mesenteric vessels.
No, structures crossed by the root of mesentery. 1. What is this? Can anyone answer this? Yo.
Third part of duodenum.
Third part of duodenum. Next. Aorta.
Abdominal aorta.
IVC,
gonadal artery.
ये कौन है ये? Who's this? The right psoas major, and the someone. Oh, there's The right ureter. There's someone lying on the psoas major. That's the right ureter. So structures crossed by the root of mesentery 1 is the third part of the duodenum, the aorta, the IVC, the right psoas major, and the right ureters. Right ureters. Okay. So certain very important MCQs. Pancreas you have to know as an organ. It's very important. Relations of the pancreas, duodenum, they go hand in hand. And साथ में पढ़ोगे, it will be easy for you. So I've given you an orientation to the pelvis and the perineum too. Okay, students, if you can quickly tell me just some last things. I'll tell you 6:35. Okay, look at this is nice. If you can quickly point it out. Yeah, na, visual slides also do come in the exams. You tell me what is this muscle? Bolo fast. Yo. What's this? Trapezius. What's this for the mandible? What's this for the mandible? What is this for the mandible?
Ramus.
Body.
Ramus of the man.
नहीं ये body है ये ramus है. एक गलत किया. You made one mistake हाँ अभी हाँ. This is the body. This is the ramus. What is this for the mandible? That's the angle of the mandible. Tell me who supplies the skin over the angle of mandible?
Greater auricular nerve.
Greater auricular nerve, which is branch of cervical plexus. Okay, that nerve which supplies the skin over the angle of the mandible is the greater auricular nerve. Just remember a very important MCQ. Here, what is this? This is the midline of the neck. This is the midline of the neck, right? Yeah. What is this here? Clavicle. Now, what is this bone here? Hyoid. We draw a line from the angle of the mandible to the mastoid process. This is the side of the neck which is divided into two triangles by the sternocleidomastoid. This becomes the anterior, this becomes the posterior triangle. Tell me what is this muscle? Fast. क्या हो सकता है? Omohyoid. Yes, very good. What is this belly? ये कौन है? Superior belly. That's the inferior belly of omohyoid. Very good, very good. Yeah, बहुत important है. Tell me what's this and what's this? Digastric. What is this belly? Posterior belly, anterior belly. Perfect. Quickly tell me what is this triangle? This is the posterior triangle which is further divided into two parts by the inferior belly of omohyoid. One.
Occipital triangle and
Supraclavicular triangle. Perfect. What is this triangle? Muscular triangle. Perfect. That's the muscular triangle. Boundaries पे MCQs आते हैं. Boundaries. The boundaries would be the midline of the neck, the superior belly of omohyoid, and the sternocleidomastoid. What is this triangle? Carotid triangle. The posterior belly of digastric, the sternocleidomastoid, and the superior belly of omohyoid. What is this triangle? Digastric. Anterior posterior belly of digastric and the bodies of the mandible. What gland lies here? Submandibular. And you get a small triangle here. That's the submental triangle. Submental triangle. Perfect. Perfect. Students, you are very good. Quickly tell me what is this vein and what is this vein?
Supraorbital
vein, supratrochlear vein joins to form a vein at the angle of the eye. That's the angular vein. The angular vein continues down as facial vein. That's the facial vein. What's this vein coming from the temporal region? That's the superficial temporal vein. That's the maxillary vein. Together joins to form a vein behind the mandible. Retromandibular vein divides into an anterior and posterior division. Anterior division of retromandibular joins with the facial to form the common facial vein, and this drains into internal jugular vein. The posterior division of retromandibular vein joins with the vein from behind the ear. What's that? The posterior auricular vein. And this vein is the external jugular vein, drains into the subclavian vein. Very good. I hope this is a good revision for you. Huh? Right, and now you quickly tell me which is the dangerous area of the face. The dangerous area of the face is the lower part of the nose and the upper lip. That's the dangerous area. A very important MCQ. And why is this one as dangerous area? Because infection from this area directly goes to the cavernous sinus. Now quickly tell me how does the infections from the dangerous area go to the cavernous sinus? One, from the dangerous area first to the facial vein, from the facial vein in a reverse direction to the angular vein, and from the angular vein there's a vein which goes to the cavernous sinus. Name. That's the superior ophthalmic vein. And the superior ophthalmic vein becomes one of the tributaries of cavernous sinus. So when you do the cavernous sinus, एक tributary होगा superior ophthalmic vein. Clear? So dangerous area, the facial vein, the angular vein, superior ophthalmic vein, cavernous sinus. Now there's one more way of spread of infection. If you can quickly tell me, what is this? The ramus of the mandible. You remove the ramus of the mandible, you go into a fossa. Name?
Infratemporal.
Infratemporal. What is this fossa? Temporal fossa. Ramus ko nikal diya. You remove the ramus of the mandible. Deep to the ramus is the infratemporal fossa. In this infratemporal fossa, you get two muscles of mastication by the name of pterygoids.
Medial pterygoid.
Medial and the lateral pterygoids. And these pterygoids are surrounded by a plexus of veins. Name? The pterygoid venous plexus. The pterygoid venous plexus. And when this pterygoids contract, all the veins are drained out of the blood. Like this is similar to a muscle in the lower limb, a muscle which has got large number of venous sinuses. Soleus. And when the soleus contracts, all the veins are drained out of the blood. Soleus is therefore known as the peripheral heart. The second peripheral heart in the body are the pterygoids. Pterygoids could be peripheral heart bolte because when the pterygoids contract, all the veins are drained out of the blood. Can you tell me when do the pterygoids contract? When did the pterygoids contract? Bolo?
18
Mastication. Mastication is fine. That's mastication. Anytime else when the pterygoids contract. Yawning. And the more you widely open your mouth, the more the pterygoids contract. You feel very nice because all the plexus are drained out of the blood. But the more you open your mouth, the chances of dislocation of TM joints are there. Okay, and when there's a TM dislocation, the jaw becomes fixed. How do you reduce the dislocation? You push the jaw upwards and backwards. Okay, so I've told you that. So this is pterygoid venous plexus. Just one fast. Tell me, how does the infection go to the dangerous area of face? From the facial vein, from the dangerous area to the facial vein. From the facial vein, there's a vein here named the deep facial vein to the pterygoid venous plexus. And from the pterygoid venous plexus to the cavernous sinus through. These are the veins which connects the veins outside the skull to the veins inside the skull. Emissary vein. So here once again, dangerous area of face, the infection first goes to the facial vein. अब दो pathways हैं. Facial vein, angular vein, superior ophthalmic vein, cavernous sinus, facial vein, deep facial vein, the pterygoid venous plexus, emissary vein, cavernous sinus. Okay. So I'll revise the triangles for you. I've told you the dangerous area of face. Then another important thing is cavernous sinus. वो एक बार देख लो cavernous sinus. Mandibular nerve is another very important topic. Mandibular nerve. And then you quickly tell me this. एक मिनट. You tell me. Vagus. Vagus gives two main branches. Just remember this flowchart. Vagus gives two main branches. One is the superior laryngeal nerve. The second one is recurrent laryngeal nerve. Superior laryngeal nerve is a nerve which arch first. Superior laryngeal nerve is a nerve which pharyngeal arch? Fourth arch. And recurrent laryngeal nerve is a nerve which arch? Sixth arch. The superior laryngeal divides into an external laryngeal nerve and an internal laryngeal nerve. Quickly tell me, what is the external laryngeal nerve supply?
The cricothyroid.
The cricothyroid. And what's the action of cricothyroid? It's a tensor of the vocal cords. It's a tensor of the vocal cords. That's the cricothyroid. That's the only extrinsic muscle of the larynx. Cricothyroid. The internal laryngeal nerve pierces a membrane. Name?
Thyroid membrane.
Very good. So the internal laryngeal nerve pierces the thyroid membrane, passes between two constrictors, passes between the middle and the inferior constrictor muscles of the pharynx. It supplies the sensory supply above the vocal cords. It also supplies the posterior most part of the tongue and epiglottis. Because the posterior most part of the tongue and the epiglottis is derived from fourth pharyngeal arch. That's about the internal laryngeal nerve. Tell me this recurrent laryngeal nerve on the left side. Where do I find the recurrent laryngeal nerve? On the left or on the right? On the left side, where do I find the left recurrent laryngeal nerve?
Arch of aorta.
It winds around the arch of aorta. On the right side, the right recurrent laryngeal nerve winds around
subclavian artery.
The right subclavian artery. This is very important. And Ikshita, I am seeing to it that embryo is also covered up. So the left recurrent laryngeal nerve winds around the arch of aorta. The right recurrent laryngeal nerve winds around the subclavian artery. This is embryology. Right, now both the recurrent laryngeal nerves are lying in a groove. Where?
Tracheoesophageal.
Tracheoesophageal groove, and both this recurrent laryngeal nerve just goes below a muscle. That's the inferior constrictor muscle. They go into the pharynx and now to the larynx. They supply the sensory supply of the larynx below the vocal folds, and they also supply all the muscles of the larynx except
Cricothyroid.
cricothyroid. Okay, so this is something that you have to know. And if you can tell me what is the vago-accessory complex. Now this is very important. Vago-accessory complex. It is formed by the vagus and which accessory? Which is that accessory which goes with vagus?
Spinal accessory.
Cranial accessory. एक मिनट. This is a very important concept to be understood. Tell me why is cranial known as cranial accessory and why spinal known as spinal accessory? Because उनका origin वैसे होता है. The cranial accessory arises in the medulla along with the 9th and the 10th cranial nerves. Along with the glossopharyngeal and the vagus arises the cranial accessory, and if I go into the medulla and I go inside the medulla, I find a nucleus which is common for the 9th, the 10th and the cranial accessory. Name of the nucleus?
Nucleus tractus.
Nucleus ambiguous.
Nucleus ambiguous. Nucleus of tractus solitarius कैसे याद रखते हो? Tongue याद रखना, tongue. Special sensations anterior 2/3 कौन है? Special sensations, taste sensations. Chorda tympani, that's facial now. Special sensations posterior 1/3. Glossopharyngeal. Special sensations posterior most part. Internal laryngeal, that's vagus. So 7, 9 and 10. Tongue याद रखना. 7, 9 and 10 का एक common nucleus है. That's NTS. Nucleus of tractus solitarius. So there will be no confusion. Just remember the tongue. And that's an afferent nucleus. Afferent. Whereas nucleus ambiguous is an efferent nucleus. It's a common nucleus for the 9th and then cranial accessory. Look, this is beautiful. You'll understand it. So there's a common nucleus for the 9th and then cranial accessory. Nucleus ambiguous, that's located in the medulla, and that's the origin of cranial accessory nerve. What is the origin of spinal accessory? Can anyone answer this? Spinal accessory. Socho, you can guess. Hey, hello. है ना सब लोग?
Cervical plexus.
एकदम शांत हो गया. Cervical plexus नहीं है बच्चा. No. Spinal accessory. It is known as spinal accessory because it arises from the upper cervical segments of the spinal cord. Spinal cord है. Spinal cord में dorsal root होता है, ventral root होता है. हाँ, dorsal horn होता है, ventral horn होता है. Ventral horn में 3 nucleus होते हैं. Can anyone tell me what are the 3 nucleus in the ventral horn? Now this is difficult. One is the lateral group, one is the medial group, one is the central group. And this central group forms 3 nerves, 3 nuclei. One is the phrenic nerve nucleus, the second one is the spinal nucleus of accessory nerve, and the third one is the lumbosacral nucleus. So what I want you to understand is the spinal accessory nerve arises in the upper cervical segments of the spinal cord. C1 to C5 segments से arise होता है spinal accessory. So spinal accessory is outside the skull. It's outside the skull. Uska friend, cranial accessory is inside the skull. Now this spinal accessory has to join its friend. So how does it go up into the skull? Answer this. How does the spinal accessory? Foramen magnum. I want a still specific answer. Foramen magnum. Now one student answers spinal accessory nerve enters to the foramen magnum. One student says it is to the posterior compartment of the foramen magnum. I give you more marks. Right? So I know the student knows foramen magnum के 2 compartments होते हैं, anterior, posterior. Okay? So if you answer foramen magnum, my next question is going to be which compartment? Anterior, posterior. Right? So right at the outset, if you say it enters the skull through the posterior compartment of the foramen magnum, searches the cranial accessory, finds the cranial accessory, joins with the cranial accessory, forms a complete accessory nerve. Now what? It will stay there happy inside the skull. No, the accessory nerve again gets outside the skull through. Bolo?
Middle compartment of jugular foramen.
Middle compartment of jugular foramen. Jugular foramen से 3 nerves आते हैं, 9th, 10th and 11th. Okay, so the accessory nerve gets out through the jugular foramen. The moment it gets out through the jugular foramen, it divides into a cranial part and a spinal part. Now, the spinal part first supplies, what's that? Sternocleidomastoid. No, first supplies the sternocleidomastoid. Now comes in the posterior compartment of the leg. The spinal accessory nerve lies on a muscle in the posterior compartment. Levator scapulae, and now goes to supply the trapezius. That's the end of spinal accessory. अब the cranial accessory goes and joins someone. That's vagus. And जहाँ vagus जाता है, उसके साथ the cranial accessory nerve goes. It forms a plexus which is known as the pharyngeal plexus, or what we call as the vago-accessory complex. Vago-accessory complex. This is a very important MCQ. वो sagittal section of face रखते हैं exam में, sagittal section of face. पूरा वाइवा हेड एंड नेक का उसी पे होता है. Tell me quickly, all the muscles of the tongue are supplied by what except what? All the muscles of the tongue are supplied by
Hypoglossal and palatoglossus.
all the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by vago-accessory complex. ये ना exceptions should be on the tip of your tongue. Second, all the muscles of the soft palate are supplied by pharyngeal plexus except tensipality supplied by mandibular nerve because it is derived from the first pharyngeal arch. Okay, so all the muscles of the soft palate are supplied by vago-accessory complex except tensipality, which is supplied by the mandibular nerve. Right, all the muscles of the pharynx के दो muscles होते हैं, एक circular एक longitudinal muscle. So all the longitudinal muscles of the pharynx are supplied by pharyngeal plexus except, this you should know, except answer. All the longitudinal muscles of the pharynx. वैसे longitudinal muscle तीन होते हैं, एक stylopharyngeus, salpingopharyngeus, palatopharyngeus. All the longitudinal muscles of the pharynx are supplied by pharyngeal plexus except stylopharyngeus. Can you get the stylopharyngeus somewhere? Stylopharyngeus. It's a muscle of.
Third pharyngeal arch.
Third pharyngeal arch. Perfect. Nerve. Glossopharyngeal. Glossopharyngeal nerve. Which is the nerve? The third arch. Glossopharyngeal. And that's how the stylopharyngeus is supplied by glossopharyngeal nerve. So all the longitudinal muscles of the pharynx are supplied by the pharyngeal plexus except the stylopharyngeus, which is supplied by the glossopharyngeal nerve. All the circular muscles of the pharynx. वैसे circular muscles तीन होते हैं, superior, middle and inferior constrictor. Inferior constrictor के दो parts होते हैं, thyropharyngeus and cricopharyngeus. Out of this, the superior constrictor, the middle constrictor and the thyropharyngeus part of inferior constrictor are supplied by pharyngeal plexus except the cricopharyngeus part, which is supplied by either external or recurrent laryngeal nerve. हाँ, so sometimes क्या होता है ना, ये सबका nerve supply is different and इसका nerve supply अलग है, and sometimes there's an incoordination between these muscles and now there's a gap in the wall of the pharynx, and this is what we call as Killian's dehiscence. Yeah, समझ गए बच्चे लोग? You understood what? The superior constrictor, the middle constrictor and the thyropharyngeus part of inferior constrictor. Inferior constrictor के दो parts होते हैं. One which begins from the thyroid cartilage, that's the thyropharyngeus part. One which begins from the cricoid is the cricopharyngeus. So superior, middle and the thyropharyngeus part is supplied by pharyngeal plexus, and the cricopharyngeus part is supplied by either external or recurrent laryngeal nerve. And sometimes there's an incoordination, there's a split in the wall of the pharynx, and this is what we call as the Killian's dehiscence. Okay, as you know, there are plenty of things to be told, but then the time is very short. One last thing. Tell me, which is the structure which is responsible for formation of all the three germ layers in an embryo? Can anyone answer this? Formation of all the three germ layers in an embryo. Epiblast. The cell responsible for formation of all the three germ layers in an embryo is epiblast. Epiblast पहले हाइपोब्लास्ट एपिब्लास्ट मॉडिफाई हो जाता है, प्रिमिटिव स्टेज के अंदर जाता है, इट मॉडिफाइज इटसेल्फ, रिप्लेसेस द हाइपोब्लास्ट, दैट इज endoderm, forms the second germ layer, mesoderm, and now replaces the epiblast, and that's ectoderm. So the cell which is responsible for formation of all the 3 germ layers is epiblast. Just one last thing, a quick identification of this. What is this that I've drawn? Come on, start.
Corpus callosum.
What are the types of fibers? Corpus callosum. Commissural fiber. What is this I've drawn? Fornix. Very good. And you tell me what is this that I'm drawing now? Septum pellucidum. Perfect. If I break this septum pellucidum and I go laterally, I go in a very big cavity of the brain. Name.
Lateral ventricle.
Perfect. Lateral ventricle. What is this structure? What is this structure that I'm drawing now? What is this rounded thing? This is the anterior. नहीं. Anterior commissure. इसको हम बोलते हैं anterior commissure. हाँ, look. Last time, Shita, over. What is this? Lamina terminalis. What do you call this as? I mean, the students are so nice. You people are so interactive. But if students are very interactive, I just love to teach. So it's a never-ending session. Okay, so what is this? Optic chiasma. What is this? The infundibulum or the pituitary stalk. That's the pituitary gland. What are these bodies here? Mammillary bodies. Very good. And as we come back, I'll draw the same color. That's the midbrain. That's the pons. That's the medulla here. And coming behind, what's this gland here?
Pineal gland.
Pineal gland. And who's this here? The cerebellum. Just above the pineal gland, I get a commissure. Just below the pineal gland, I get a commissure. Name.
Posterior and habenular commissure.
This is the habenular commissure, and that's the posterior commissure. The posterior commissure, the habenular commissure, and the pineal gland together constitutes
Epithalamus.
So epithalamus is made up of pineal gland, the posterior, and the habenular commissure. What is this entire area known as? The diencephalon, and there's a sulcus here which divides the diencephalon into what's this? Thalamus. And what's this? Hypothalamus. And then there's something here. I'm not changing the colors now. What is this number 4? ये कौन है? ये number 4. Fourth ventricle. And what is this? This is the aqueduct of Sylvius. Aqueduct. And what is this and what is this that I draw now?
Superior inferior colliculus.
Perfect. The superior and the inferior colliculus. Very good. Tell me, if I draw the complete brain like this, what is this view? What surface of the brain is this? Medial surface. And what section is this? Sagittal section of the brain. Okay. So what is this entire area known as? This entire area is the third ventricle. ये जो देख रहे हो ना आप, that is the third ventricle. So if just imagine if this is the third ventricle, the room in which you are sitting is the third ventricle. The upper part is the roof, below is the floor. आगे anterior wall, पीछे posterior wall. And what are these two walls on your either sides? Lateral wall. So if this cavity is the third ventricle, look. This is thalamus of one side. ये एक side का thalamus है, ये hypothalamus है. What is this sulcus here? Hypothalamic sulcus for one side. For this side, this is the thalamus, this is the hypothalamus. That's the hypothalamic sulcus. Now, if I join these two hemispheres like this, hey, it's not like this. They don't stick to each other. No. The thalamus and hypothalamus are concave. ऐसे concavity होती है. That's thalamus, that's hypothalamus, that's a sulcus. It's a concave structure. For this side, the thalamus and hypothalamus are concave. And now when we join these two hemispheres like this, we get a cavity right in the center. And this is the cavity of third ventricle. That means third ventricle, कितने होते हैं? How many third ventricles do we have? Only one. We've got a single third ventricle. Right, and when we take a section, ये दो hemispheres है like this. When we're taking a section like this, what is this section? What is this section going to be? A sagittal section. That means we are actually cutting through the third ventricle. You are actually cutting through the third ventricle. तो ये जो area आप देख रहे हो, this area is nothing but the third ventricle itself. ये third ventricle ही है. मतलब roof कौन बनाएगा? Quickly answer. The roof of the third ventricle would be formed by the fornix. The floor would be formed by optic chiasma, the pituitary stalk, the mammillary bodies. The anterior wall will be formed by the anterior commissure and the lamina terminalis. The posterior wall, the pineal gland, the posterior and the habenular commissure. And tell me students, the lateral wall will be formed by what? The thalamus and hypothalamus. Thalamus and hypothalamus ये lateral walls बनाते हैं, तब वो cavity बनती है. Then you get a cavity in between, and that is the third ventricle. Okay, so that's how it is. I hope you've understood this. And if you break this and you go inside this, what is that? Lateral ventricle. And this lateral ventricle would communicate with this single third ventricle through, what is that arrow? And this, yes, and this third ventricle would be communicating with the fourth ventricle through this aqueduct of
cerebral aqueduct.
Listen, there are plenty of things to be told and to be understood, like sections of brain and the functional components. All those I just love to teach, but इतना time नहीं है ना. ठीक है. So I hope you've understood anything. If you have any queries, you can ask me. If you have any queries, कुछ doubts है, so you can ask me. So this is what brain में you have to know about the ventricles, the third ventricle, the lateral ventricle, the internal capsule. You have to know the functional areas, the blood supply. That's a very important thing. The circle of Willis, short notes, standard questions है, standard questions ही आते हैं. But ठीक है, study from the point of view of exams, that's fine. But study the concepts also. It will always help in your. Because when I teach the interns, the post interns, and now when you look at anatomy, I mean, it's a totally different concept, a totally different understanding, and then it's wow. Okay, because in the first year you do not have so much time to think, but अभी तो सारे exams postpone हो गए, तो if you have time, you can just go into it. Okay, anything, anytime required, I'm always there to help you. Your Ipshita is also there and Ms. Dash is also there. Okay, the organizers of SAMSA and the inspiring leaders. Okay, I hope you've understood everything. Yeah, best Ipshita. Thank you for all, and thank you Ipshita. And your name is. Hey, you mute हो गया?
Sir, you're on mute. We cannot hear anything.
Okay. So I hope now I'm audible. Okay. So thank you for giving me an opportunity to all the organizers, especially Ipshita and Ms. Das. Your name is difficult to pronounce, that is why I'm calling you Ms. Das. Okay, so thank you for giving an opportunity, and I hope you've understood everything. It was a quick revision, and if you have any time, any difficulty, if you're not able to anything under the sun of anatomy, you can always ask me. Okay. Thank you, and I hope it was an informative lecture and you've enjoyed it. But it was, I enjoyed taking the lectures. You all were very, interactive, and that's how you just go into the topic. Discuss, form groups, discuss with your friends, draw diagrams, draw line diagrams, and see this netters, see Themis atlas, see netters atlas, and then you just try to think, because you know what, if minds don't know, eyes don't see. That's a very common saying. Okay, this is a very important saying. What minds don't know, eyes don't see. So when you're doing a surgery or when you're dissecting something, if you know that thing is there, you will see it. But suppose if you do not know, like femoral nerve lies in the iliopsoas groove and you're dissecting there, you cut the femoral nerve. But agar aapko ye pata hai, so you'll be always cautious about this. Okay, what minds don't know, eyes don't see. So when you're seeing the visuals also, just try to think about it. Everything Nettis has drawn it so well. Themis atlas is a beautiful atlas. Just go through all these things, and thank you to all of you. I hope everything is clear. Thank you.
Thank you, sir. Thank you so much.
Thank you, sir.
So,
it was an amazing session, and how the 2 hours flew by, it was magical.
I have got the shortage of time. Like I would have continued, and students are also good. पढ़ो एक बार वापस organize करेंगे. You organizers are very good.
Absolutely, sir.
Always.
Really love that. We in fact, the organizers, we actually have a group, and we are all discussing that how and that we don't want it to end actually.
It's a link, like you just go on and study for the quiz, and enjoy the quiz and the vibes in the quiz. Okay, so see you all then on Thursday. All the best, and thank you once again. Thank you.
Yes, sir. If you do not mind, we would just like to play something. to tell everybody present here about SAMSA and who we are.
Please, go ahead.
Okay, sir. Thank you, sir.
So I'll be here, no? Or should I leave? Hello?
Sir, stay please, sir.
Okay, fine. Go on. Very nice, sir. You are doing a very good work.
Well, hopefully we try to give this our best.
Yeah, so, anything you require in Mumbai, I'm always there to help you out. Okay?
Thank you for the message regarding this.
Yeah, you're doing a good job.
A lot of things.
Yeah.
And given the kind of response you've always given us, so we would always love to work with you, and we would look forward to having you here in Bengal soon.
Yeah. I've been coming to West Bengal since so many years, and I've seen all the auditoriums from Natural Munch to I don't remember, near the Jyoti Cinema and all. Very beautiful auditoriums I've seen in Calcutta, and I've even in the schools sometimes the lectures used to be there. Very nice auditoriums, nothing like that. Arvindu, I don't remember the names, but काफी थे auditoriums. The best was Natural Munch, a big auditorium where the CM takes her meetings and all. Right. Anyway, thank you to all of you, and I hope you've all enjoyed the session and the organizers, and it was good interacting to you, and I'm very free to talk. ठीक है, like I enjoy being with the students and working with the students on this, so we always feel young. Okay, chalo, thank you.
Yes, sir. Thank you so much, sir.
Bye. I'll leave the meeting. Thank you.